Welcome, everyone. We'll go ahead and get started. I want to welcome everyone to Stanford and the very first Gastric Cancer Summit here at Stanford, and hopefully this will be the first of many. I really do appreciate everyone's efforts to make this. It was going to be a bit larger meeting, but I think fortuitously, primarily we have all the speakers have made it, and I always did want this to be a true working summit, but we had grander plans to bring in more people from the community and other societies, but because of the whole COVID-19 thing, there were many people who chose not to attend. It's turned out to be a good thing because yesterday Stanford put a limit on any meetings that are over 150 people. So we fell underneath that radar and we were allowed to continue, at least today. We'll see what happens tomorrow. But I do appreciate, literally all our speakers are here. We had a couple from Asia that couldn't attend because of restrictions on travel, but I appreciate everyone's dedication, and I think it really speaks to how important this field is. As we were sending out the agenda around the entire country, the community, we just had glowing remarks on, I had comments like, how did you get all these people to attend one meeting? And so we really have the cream of the crop in the field of gastric cancer. We're extremely excited about holding this summit. This concept has been a quest of mine for many, many years, even before I moved down to Stanford. I was at the University of Washington for many years and have been exposed to gastric cancer, early gastric cancer with my roots to Asia, and had been invited to multiple smaller conferences. Yang knows what I'm talking about. Very fragmented, a lot of people who were passionate about this but had trouble connecting. And after I moved to Stanford and met Latha and Bryant and realized we have a platform here called the Center for Asian Health Research and Education, I felt that this was really the ideal setting to bring together the gastric cancer community and to try and get us to work together to collaborate on advancing this, I think, much neglected field. I think that there is so much that is really not understood, and we'll be discussing a lot of that today. So I'm glad that we were able to put this summit together. And Latha and Bryant will give introductory remarks about CARE in just a minute, but I think that the CARE organization, the Center for Asian Health Research and Education, is critical to this, and I'm excited to be a part of this. Just a little bit on how we structured this meeting. The first day, really, we're going to focus on health policy, and that is, what can we do today to move this field forward? Because I think that there is already plenty of data. We got a lot of knowledge out there. Let's bring it all together and see if we can't impact policy, especially in terms of guidelines with society, and ideally with the USPSTF. So that's kind of our home run swing. We're lucky that we actually have the current chair of the USPSTF on faculty here at Stanford, and we've been in active discussions with him. And we think that we have a legitimate shot at a potential guideline out of that organization. So again, the overall goal of this particular summit is to work as a community to advance the concept of prevention and early detection of gastric cancer, because again, I think we all recognize that that's the only way we're going to make an impact in outcomes of gastric cancer. And the outcomes in the U.S. for gastric cancer, as many people will discuss, they're not good, and they could be substantially better if we look at our counterparts, especially in Korea and Asia, who have solid gastric cancer screening programs. So that's the overall goal. Some specific goals, after this, the second day will be a research-focused day where we're going to talk about, how we're addressing some of the gaps in knowledge. And then after the summit, we are planning to come out with a white paper that all the speakers will be hopefully a co-author on. And this will be kind of the basis that we are going to present to the USPSTF to provide them with the landscape of gastric cancer and hopefully help them make a decision to at least review. I mean, we might not get approval, but it'd be nice to at least have them review the status of gastric cancer to make a decision. And also, again, one of the things that I think Doug Owens will speak on in a brief video is that just by going to the USPSTF and getting on their radar, they can also prioritize or tell us what priorities of research are, and that also gets communicated with the NIH, and hopefully that will help with funding of this field. From some practical aspects, I really do want to acknowledge this summit is being funded by a very generous donor, and I want to thank the donor for believing in this cause, and hopefully we will have future donations to support another meeting. And I want to thank everyone who helped with the organization of this, especially Shannon Judd, who I think is still outside. But if you see her, please let her know how much how much effort she put in, and give her your appreciations for all the organization. And she's organizing all the staff as well. So with that, I would like to introduce Dr. Latha Palaniappan. Did I pronounce her last name correct? I always have trouble with that. Her and Bryant Lin, Dr. Bryant Lin, are the co-directors of and founders of the Center for Asian Health Research and Education. I think this is an amazing center, a much-needed center, and I'll leave it to Latha to kind of explain what CARE is, and hopefully we also disseminate this concept of care and create some type of national network for overall Asian health. So with that, thank you for attending, and I'd like to introduce Latha.
Good morning, everyone. Let me join Dr. Hwang in welcoming you to Stanford. My name is Latha Palaniappan. I'm a professor of medicine and primary care population health here at Stanford. Dr. Lin and I started the Center for Asian Health Research and Education in 2018. Asian Americans make up 7% of the US population, 14% of California, and 1/3 of the Bay Area. All of us as faculty members at Stanford, 1 out of 3 of our patients that walk through our doors are of Asian descent. And there is very little data in our medical literature to guide our decision-making in these populations. And in the Bay Area, we have the unique microcosm of the world representing all of these Asian subgroups, which gives us the unique opportunity to do the basic science, physiology, structural morphology, and population health science that will affect the world. This is always a surprising statistic, and it has changed over the 2 years that we have started CARE. Can anyone in the audience guess what proportion of the world is Asian? It was 52 years ago. It's 60% now. It's over half of the world is Asian. So the work that we do here to improve care can affect half of the world. So we're very excited about that promise, not only in gastric cancer, which we'll talk about today, but in every disease area. We have over 100 faculty at Stanford who Dr. Hwang leads in terms of energy and charisma and drive, but 100 faculty like him who are interested in their specific disease areas to improve health for Asians. So I'm excited today to work with you on gastric cancer. There are 27,000 people who died in the United States last year from gastric cancer. There are less than 10 people who have died in the United States this year for an infectious disease that has made the headlines for the last month. Next year, no one will die of that infectious disease in the United States. Next year, 27,000 people will die of gastric cancer. And that is what we are here to change today. And I'm going to paraphrase a quote from Margaret Mead. Never doubt that a small group of committed individuals can change the world. Indeed, nothing else has. So to echo Dr. Hwang's comments, I am glad that we are a small group of committed individuals because we will change the world here today. And we are ably led in this endeavor by Dr. Hwang. Dr. Hwang did his medical training, as many of you know, at the University of Chicago. He did his internship and fellowship in gastroenterology and a PhD in bioengineering at the University of Washington. He completed his junior faculty years at the University of Washington, earning over $10 million in NIH grants, writing almost 200 papers, earning the Top Doctor of Seattle Award, and mentoring over 50 individuals in gastroenterology. We were fortunate to lure him to Stanford a few years ago. And what I have been most impressed by in the last couple of years that I've known him, and particularly the last 9 months in which we were planning this conference, is that he is a brilliant endoscopist, and he has the ability to go beyond the lens of his scope and think through the lens of populations. And he has the vision, charisma, and leadership to change how we practice gastric cancer screening in this country. So our goal today is, as Stanford Medicine's goal, to provide precision health for diverse populations, to better predict, prevent, and treat gastric cancer. So please join me in welcoming Dr. Hwang back to the podium. And because I study sedentary behavior, I'm going to ask you all to stand up and give Dr. Hwang a standing ovation.